Okay guys, so now we would be seeing the disease called pseudomembranous colitis. So it is basically a post antibiotic associated diarrhea due to inflammation of the colon as a result of toxin damage to the mucosa. Okay, so what would be the presenting complaint or clinical features? The patient would mainly present with diarrhea. So the nature of the diarrhea is characteristic. It is explosive watery diarrhea. Okay, so now this would be associated with abdominal pain and cramps. Okay, now, so what would be the pathology for this? The patient would generally present or may have a history of having antibiotic course within a span of say 3 months. So history of antibiotic course within less than 3 months. So the main antibiotics given to the patient would be cephalosporin or clindamycin. For the second condition for this is hospitalization for a period of more than 48 hours. Hospitalization more than 48 hours. Okay, so what happens after the antibiotic course? So normally in our gut there are good bacteria and bad bacteria. So normally there is a balance between the two. Now what happens after the antibiotic course is the main mission of the antibiotic is to ward off the bad bacteria, but what it does is also the good bacteria is killed. So now after the antibiotic course, if some amount of bad bacteria persists, so there is proliferation of the bad bacteria and there is no good bacteria to oppose or to prevent its excessive growth. So now what happens after the antibiotic course? The bad bacteria proliferates. So the most common culprit here is Clostridium difficile. Okay, so now this organism would be releasing toxin A and toxin B. This would cause damage to the mucosa and subsequent formation of pseudomembrane. Now also the toxins would attract the toxins would draw all the water in the gut, and this would be responsible for secretory diarrhea or say watery diarrhea. Okay, now after this we would see what would be the investigations for this. The investigations would be, the best one is PCR for Clostridium difficile gene. Then the second best would be an enzyme immunoassay for the toxin A and B, and then an enzyme immunoassay for glutamate dehydrogenase. Okay, so all these tests are ideally expensive and not possible in government setup, but PCR is done in private setup, say, or we can do these things in government setup. And stool culture does give a diagnosis for the Clostridium difficile, but the drawback here is it takes too long, or it means the patient would not benefit much till the reports of the stool culture come. So the enzyme immunoassay for toxin A and B and enzyme immunoassay for glutamate dehydrogenase are the investigations most routinely done. Okay, now after this, the histological picture of the mucosa would be, we would get mushroom or umbrella shaped raised structures above the goblet cell layer, of the intestine. And finally coming down to the treatment part. Now here the drug of choice would be vancomycin, basically to clear off the Clostridium difficile over multiplication. And actually here now the treatment of choice would be a fecal transplantation. Yes, it does sound weird, but fecal transplantation is the treatment of choice. Now what we do here is we introduce the fecal mass from a person with no infections, basically a healthy gut, and the main objective of this is to introduce healthy flora in the gut of the affected person. So fecal transplantation would be the treatment of choice here. So that's all about pseudomembranous colitis. we'll just have a recap. Pseudomembranous colitis is a post-antibiotic associated diarrhea due to toxin insult from the Clostridium difficile overproliferation, and the clinical features would be explosive watery diarrhea associated with abdominal pain and cramps. The pathology would be a history of antibiotic course within a span of 3 months, and then or hospitalization for more than 48 hours. And the most common antibiotic is cephalosporin and clindamycin, which have a propensity to cause this disease. We saw the mechanism. Antibiotics damage both the good and bad bacteria, but some persistent bad bacteria remain in the gut and they have unopposed multiplication, the main culprit being the Clostridium difficile. It releases the toxin A and B. The toxin causes damage to the mucosa and formation of pseudomembranes. Also, the toxin draws water and causes watery diarrhea. And now the investigations, the best would be PCR for Clostridium gene and enzyme immunoassay for toxins A and B, and enzyme immunoassay for glutamate dehydrogenase. Stool culture takes too long, so that's not preferred. Histology would be mushroom or umbrella-shaped raised structures above the goblet cell layer. And the drug of choice would be vancomycin to clear off the Clostridium difficile infection. And the treatment of choice would be finally fecal transplantation.